A security breach, now another headache for people looking for help from MNsure, the state's new health insurance program. Tonight we spoke with a family of 4 who can't afford the assistance that they desperately need. In fact, Jay Coles met with the family, and Jay, they have a problem that a lot of families who are trying to sign up with MNsure might actually run into as well.
Yeah, it's kind of an interesting thing. You know, the goal of MNsure is to provide health insurance for those who don't have it and offer others a chance to shop an expanded market for money-saving options. But we found a set of circumstances that could keep health insurance out of reach for many hardworking families.
Putting food on the table and a roof over their heads is hard enough for Minnesota families. Now mix in some rising health insurance costs and what do you get?
Oh, stressed out, right, guys? I mean, stressed to the max, yeah.
Jennifer Slafter and her husband a couple months ago were told this by their health insurance company.
I think we went from $721 a month to $892. And that's for a $4,000 per person deductible. So that was a pretty big leap.
The small company her husband works for told them changes in the Affordable Care Act meant he could no longer offer a flexible spending account to help offset the increases. So they went to the MNsure website looking for help.
And it had a $6,000 deductible for the family, and it was over $1,000. And we went, oh my.
They then called MNsure looking for an explanation and were told they could have a cheaper option, but their 2 daughters would have to use a Medicaid plan.
We feel like it's our responsibility to take care of our children and that we're a family and we should sort of sink or swim together.
Plus, they live in rural Fillmore County, where Jennifer was told there are no Medicaid providers right now. So no doctors would have been close and they'd have to cut ties with their current doctor.
Scared. There've been a lot of sleepless nights, a lot of tears, a lot of frustration.
We've tried for a week to get answers from MNsure, but only got this written response that says, in part, privacy laws prevent us from getting into details involving specific families. And situations like the Slafters arise under the Affordable Care Act because the ACA requires that a state maintain the income eligibility levels for children on public programs that existed prior to the ACA, which leaves few options and much higher medical care expenses.
I really felt that this was going to help us, and it didn't. It made things exponentially worse for us.
And for now, the Slafters say they will stay on their current plan and hope for more overtime at work to cover the extra costs. They also say they contacted the offices of Senator Franken and Senator Klobuchar and have not received any response yet, Leah.
Certainly a difficult situation for this family. Did they look into private plans, a different private plan than what they have?
They did, and you know, the roundabout way they got back to MNsure was there wasn't anything cheaper with private plans, so they thought MNsure would be the answer, and they just didn't get the answer they were looking for, so they're going to continue. And as she said, for now, we're just going to stay with the current plan because it seems like to be the best option.
Let's hope they find something better, Jay. Thanks.
Yep.
Bill?
Well, it is.